It's not something that could happen by accident. Somebody clearly fabricated this image. The bands are all copies of one another. They've just been rotated and spliced and everything. They've superimposed a gray square over most of the background. 207 images feature this exact background pattern. Some of them feature the same blots as well. Until we have the original images for these, it's not even clear what they're trying to cover up. I think I found this one and I realized how bad the situation would be.
Well, that was a spooky intro. Hello! A couple of weeks ago I was on Bluesky and I saw researchers talking about how some verification data for antibodies on a website for a major supplier appeared to have been manipulated. And I had no idea what any of that meant, but it seemed important. So I did a little bit of research and I reached out to...
My name is Reese Richardson. I am a postdoc at Northwestern University currently, and I study the science of science. So I use the scientific method to study the scientific enterprise itself. And a lot of that has to do with fraud in science.
First off, you might be hearing antibodies and thinking, the thing in my body? Which, yes, it is the thing in your body, but we've adapted antibodies to be useful in all kinds of biology lab applications. When your immune system is cataloged a specific bacteria or virus or like a random piece of peanut it's decided you're allergic to, it will send out antibodies to specifically attack one of those invaders. And an antibody is always specifically attaching to a protein on one of those invaders. Being able to attach to a specific protein is really useful for biologists. So scientists can use antibodies to do all kinds of stuff in research. Totally random example, here's a group of scientists that used antibodies to see if drought levels affect how much of a specific protein shows up in wheat. Talking about varieties of grains, which, that's not immune system.
So you want your antibodies to be sensitive. You want them to detect the protein that you're going for, right? You also want them to be specific. In most applications, not necessarily all of them, you want them to bind only to the protein that you're interested in.
You might be like, whoa, so you can do all of that with antibodies, but they're originally from living things' immune systems? So how do these scientists get them? Well, they buy them.
Most of the people that I know, when they need an antibody for something, they're turning to a large manufacturer like this and buying something from their catalog or ordering from them custom, which most of these big vendors will do. But yeah, it's a laboratory reagent in the same way that a petri dish or a microscope or a pipette is laboratory equipment. You could also consider antibodies to be a reagent or equipment.
And if you're buying a tool, you want to make sure that it works as advertised, right? Imagine you are buying a game cartridge and you pop it into your Game Boy and it just constantly crashes. That's not a Pokemon. And you look on the box and you notice there's no Nintendo seal of quality. The equivalent of the Nintendo seal of quality for these antibodies is verification data. Okay, it's not a one-to-one. I thought Nintendo seal of quality was funny. It's not a one-to-one. They just serve a similar purpose. Suppliers will run tests with their antibodies and post the data alongside it to be like, look, the thing that we are selling will work as advertised. There are different tests you can run to do this, but the smudge images we're looking at are just one way of doing that. They're called Western blots, which is just a way of seeing how much of a particular protein you have in a sample. To verify your antibodies, you'd run a Western blot on two samples, one that you know has your target protein and one that you've confirmed doesn't have it.
You want to see that there are spots at the molecular weight that you expect that protein for the samples that you expect that protein to show up, and that it only detects that protein. You're not seeing a bunch of bands all over the place, right? If you have even 2 bands in your sample for a cell line that you're trying to detect this particular protein in, and you know that that protein only has the one isoform at that one molecular weight, that second band indicates that it's detecting a different protein. So it's not specific to your protein of interest.
So if someone's going in and cleaning up some images, it's going to make it look like that antibody is more certain, more specific than it is.
Yes.
And now we come to Thermo Fisher, a Fortune 500 company and one of the major suppliers for antibodies for scientists, among a ton of other pharmaceutical and biotech stuff. In your own words, explain what the issue is with the Thermo Fisher data on their website.
There are hundreds of images, primarily Western blots, in the Thermo Fisher antibody catalog that are presented as verification data that have apparently been manipulated. My buddy and colleague, Sholto David, who is himself an experienced sleuth for finding images in the published scientific literature, was the one that initially stumbled across this. He wanted evidence that a particular protein was not expressed in a particular cell line. And he turned to vendor antibody data because he figured that it would be trustworthy. And then he found one image that is totally fabricated. The bands are all copies of one another. They've just been rotated and spliced and everything. It's not something that could happen by accident. Somebody clearly fabricated this image. And then somebody else came online and found another one that was a very similar situation. And then I thought, well, where there's smoke, there's fire. So I started looking, and within an hour, I found a dozen. And then within a day, I found 100. And it just kept getting worse. We've now published all of this information in an open repository. We've set up a form so that people can submit antibody images that they notice have apparently been manipulated. And we're up to 450 plus for Thermo Fisher as of the time that we're talking now.
By going into a program like Photoshop and bumping the contrast, or just sometimes by using your eyeballs, these images start to look suspicious. And now I get to do the YouTube thing where I show you the same clips I showed you at the beginning, but now you have way more context for what you're looking at.
They've superimposed a gray square over most of the background, notably outside of where the blots are expected to show up. Some of the painting in these is just ridiculous.
The one that's the zigzag.
Yeah, exactly.
All over,
and
yeah.
It's I don't even know, until we have the original images for these, it's not even clear what they're trying to cover up. And this is sort of, I think I found this one and I realized just how bad it was, how bad the situation would be. The image is so high resolution that it leaves absolutely no questions about what happened here.
Again, if you're cleaning it up, it's you are cleaning up something that it's clearly longer than it's supposed to be, and where it's not be as specific. Yes.
That seems most likely to me. What happened is there's a band there that shouldn't be there if this antibody was as sensitive and specific as they're claiming, and somebody painted it out.
Yeah.
Some of them feature the same blots as well. So the exact shape is the same between the two of them.
Corporate needs you to find the differences between this picture and this picture.
When I was looking through your blog post, the most damning one that I saw was that GIF you put together where it's just the same background on every single one.
Yeah.
That they just
right?
Yeah.
That one is background pattern A. And as of right now, if I just pull up the spreadsheet really quick, we've identified 207 images in Thermo's catalog that feature this exact background pattern. And we've now found that same background image in an entry in Abcam's catalog, another manufacturer. So no clue what's happening there. It requires full transparency on the part of these manufacturers for us to actually know what transpired here.
Now, manipulating a Western blot doesn't necessarily mean someone is trying to fake an antibody. It could also just mean someone is trying to pretty up a messy experiment.
Western blots are really difficult to pull off, and they're time-consuming. Every biologist has had an experience where they run a Western blot and it looks like Jackson Pollock, right? So someone might manipulate the image to make it look like they ran a cleaner Western blot than they actually did. That is basically just a time-saving measure. I don't want to repeat this Western blot so that I get something cleaner. But that too is misleading, especially, if you're telling people oh, you should expect your Western blots to look like this. An unrealistic beauty standard, if you will.
And this whole situation ties into a larger problem. Antibodies already have a reputation for being a bit of a nightmare to work with. So much so that there's this thing that's been called the antibody reproducibility crisis.
Antibodies in general are quite a fickle reagent. Some folks on the Icarus project estimated that 50% of commercial antibodies sold on the market fail in one or more tests that they throw at them. A big issue is that many scientists, either out of necessity or just out of trust of manufacturers and their processes, will use these antibodies without double checking that they're actually doing what they're going to be doing. That is incredibly expensive to do, and it's incredibly time consuming. But if these tests are not performed, that can lead to lots of people using antibodies and struggling to use antibodies that don't work. Even worse, people will use antibodies that don't do what they claim to do and will report findings of using those antibodies that are wrong. So yeah, it's quite a dismal situation.
And so if someone is putting supposedly manipulated verification data on their catalog pages, that is certainly not helping. Thermo Fisher did put out a public response to the whole situation. It's a 15-point FAQ. They do mention that some catalog images may have been adjusted to clarify for presentation purposes, but deny that these adjustments misrepresent the science behind the images in any way. Do you want to talk about the Thermo Fisher's response and also your reaction to it?
The idea that what occurred here was optimization for presentation and clarity is a farce. Them saying we stand behind the data 100% is damning. I wouldn't stand behind this data, right? Like it's kind of insulting, right? To say like, oh no, there's nothing to see here. And then they say later in the page, how are we going to stop this from happening again? Stop what? You just said that nothing.
You just said there's not a problem.
Right.
I reached out to Thermo Fisher for comment, and I genuinely didn't expect to hear back from them, but they did get back to me. Their whole comment is on screen, but they specifically say they are working to ensure images are clearly identified as either raw unedited or as images that may have been edited, optimized, or otherwise adjusted. Where available, raw unedited images may also be provided to website users and customers upon request. But also, it appears that a few days after I emailed them for comment, they changed their FAQ. It's now 7 points. I think the most notable change is they have removed anything along the lines of, these adjustments should not alter the scientific meaning of the data. Now, stories like this can leave non-scientists going, oh my god, science is broken. I can't trust anybody. Big Pharma's out to get me. Big Pharma would be a really good drag name, by the way, for like a plus-sized queen. So I asked Reese what he thinks non-scientists should take away from all this.
There are many, many, many moving parts. Universities and other research institutes that support researchers, trainees that are doing a lot of the research, vendors and manufacturers, grants from federal agencies, journals that are run by publishers, journalists. Failure can happen in many of these places, and it often does. That does not mean that the scientific enterprise is not to be trusted in general.
Like, if for somebody who doesn't interact with science very much, it's just, there's this block in their head of like scientists. But like you just said, there's so many moving parts. There's a bunch of different points of failure. It is not just person in a lab decides they're going to fake something.
Yeah, this is something that in research about scientific fraud, we wrestle with this constantly, because scientific fraud does decrease public confidence in science. A lot of the time, our findings get weaponized by people that are actively trying to dismantle the scientific enterprise, which is the exact opposite of what we need. But basically, the only way that we can make the scientific enterprise better at what it does and a more effective benefit for humanity overall is through transparency, so that we know when these lapses of integrity have happened. Most scientists out there take great umbrage with stuff like this, and they're not willing to turn a blind eye to abuse of trust and processes.
This is my opinion. This is my opinion. This is my opinion. This part, This part is my opinion. The researchers who are purchasing these potentially fishy antibodies are the victims here. Well, like those scientists and also like society, because, you know, it makes the research harder and we don't get the benefits that we would have gotten otherwise. I said this earlier, but Thermo Fisher is a huge company and antibodies are not the only thing that they do. They are comfortably chilling in a decent number of y'all's 401ks. In addition to being like time consuming and difficult to work with, these antibodies are not cheap. If they are posting manipulated verification data, Thermo Fisher is pushing the cost in terms of time and in terms of money onto researchers when they could definitely afford to be doing things the right way. And now we're leaving the opinion zone. There are ways scientists can help with the transparency piece that Reese was talking about. One is by validating the antibodies themselves, meaning like you test it when you get a hold of it and not just trusting the manufacturer's validation data at face value. And then you share that validation data with other scientists.
Validate your reagents. This will save you a lot of heartache in the future, and it may save a lot of heartache for others too, especially if you put that information out there online. That's sort of the point of doing science. Even if you feel like you're working on something quite mundane, by putting that information out there about what you found, you're saving somebody in the future a lot of work on their end. There's this organization called Icarus. They are all about antibody validation, and they've developed a number of gold standard pipelines for how you can do it.
And if you want to dig through the catalogs of either Thermo Fisher or other antibody suppliers for more suspicious validation images, you can submit them to a form that Reese and Sholto set up. Thank you so much for watching. If this is the second video of mine that you've watched, I would really appreciate it if you subscribed. If this is the first video of mine that you watched, I'm not going to ask you to commit yet. Go watch another video of mine and then decide. My goal for this year is to post one video every month. And so if it is August of 2026 and there's no video posted between now and the time that you're watching that, you have to yell at me. Thank you, bye.